Hey Future Horizons, today we have with us a very special guest, Dr. Shantal at North Bend Clinic.
Hi everybody, good afternoon.
How are you doing?
I'm great, how are you?
Good, thank you so much for coming onto our podcast.
Of course.
So what inspired you to become a nurse practitioner and why did you choose family medicine?
That's a great question. So I actually got my undergrad in nursing in Hawaii. That's where I'm from. And a little backstory, I had food poisoning during a college football game, and I had the best nursing care from my nurse in the emergency room. The emergency room physician was not caring or compassionate. And so that's what inspired me to become a nurse. And so I got my bachelor's in nursing. And I was also in the U.S. Army as an Army nurse, active duty. So that's what brought me to Washington State, actually. So I was stationed at JBLM at the Madigan Army Medical Center. There, I was a Army nurse on a medical surgical ward. And it wasn't really until 3-4 years later that my mentor in the Army told me about becoming a nurse practitioner. You know, we were seeing the same patients coming back for exacerbations of chronic disease that I felt like, you know, in the primary care setting could have been prevented. And so she told me about becoming a nurse practitioner, and I did not have a specific interest, and I saw family medicine or family practice where I could treat the whole entire family was very appealing to me. And so I applied to the University of Washington Doctor of Nursing practice and got in. And so the fall of 2017, I started that 3-year program and then graduated my doctorate in nursing from UW right at COVID, March 2020. And here I am now.
It's a beautiful story, very inspiring.
Thank you.
What does a typical day look like for you in your role?
So I'm currently a nurse practitioner in family medicine at Snoqualmie Valley Health. We just opened up this beautiful practice in North Bend Clinic end of October 2025. So it's very
recent,
new.
yeah.
Yes. And in family practice, we see everything. Being a nurse practitioner in Snoqualmie Valley, I get a good variety from different socioeconomic backgrounds, ethnicities, which I do enjoy. A typical day, I see about 15 to 20 patients. I work 4 days a week, Monday, Tuesday, Thursday, Fridays, 9-hour days. And I see anything and everything from pediatrics, cough and colds, to ADHD, obesity medicine, to chronic disease like type 2 diabetes, hyperlipidemia, and managing that. My team, we now have an internal medicine physician that I enjoy working with. I also do really cool procedures like IUD insertions, Nexplanon, another contraceptive, long-acting contraceptive, reversible contraceptive, skin biopsies, and that's all I can think of right now. But a really good variety, which I enjoy.
Like, patient group, that's pretty cool. You get to see a bit of everything.
Exactly, and nothing's too boring. And if anything that, you know, I cannot solve or need more resources to, there's referral, you know, external providers or internal specialists that we can refer to for further evaluation.
Sounds like a lovely experience.
It is. I really enjoy working here. I've been with Snoqualmie Valley Health for the past 4 years now.
Oh, nice. It's been a while.
And I'm also a resident of Snoqualmie Valley. So it brings me a lot of joy to be able to serve the people in my community and their families.
It's very beautiful. What are some of the biggest challenges you faced within this career?
One of the biggest challenges as a family nurse practitioner is, you know, knowing the best evidence-based treatment and management for my patients, but having restrictions based off insurance. Insurances unfortunately dictate a lot of what we can and cannot prescribe, and even though it is the first line, you know, recommended treatment, it doesn't mean that insurance will always cover it. And there's, again, a lot of people with different socioeconomic backgrounds that may not be able to afford it, or insurance may not cover it, thereby, really limiting their care, and then affects their quality of life and treatment plan. Another challenge is the opiate epidemic that we are facing now. Because, about 20 years ago, for someone with back pain, it was very common to get prescribed a narcotic such as, oxycodone, but then they fall into dependency and abuse, and, trying to address that in a safe manner to taper them down or taper them off. And sometimes, just meeting with, eye to eye with the patient and setting realistic goals. And sometimes it doesn't go the best way, but, we try our best as clinicians and providers to practice evidence-based medicine, and just finding that right medium.
I can imagine that must be hard.
It is quite a challenge. But at the same time, it's very rewarding when a lot of it is a knowledge deficit with the patient. They didn't know that there were other safer modalities for their chronic pain, and to be able to educate them on it, and they're eager to make these changes, and then to see the improvement of their quality of life, as well as tapering down on the opiates. It's so rewarding to see that, and their outcomes are even better than when they were on that high dose narcotic.
I can imagine. How does the role of a nurse practitioner differ from other healthcare providers such as PAs and RNs and doctors?
Okay, so nurse practitioners fall under the category of advanced practice providers. And so we're in the similar umbrella to physician assistants. I don't know too much about physician assistants, but with nurse practitioners in the state of Washington, we can practice solely independently. So nice. I could open up my own practice if I wanted to. I think I'm not sure, with physician assistants, they still need to be under the supervision of a physician. But as far as prescribing, management, it's the same. And this is in regards to a physician assistant in primary care. Nurse practitioners in comparison to registered nurses, so we have to keep our registered nurse license up to date, as well as our advanced practice license. So we're still an RN, but what differs us is that registered nurses cannot prescribe, manage, treat, and that's where nurse practitioner school trained us for the advanced practice. Does that make sense?
That does make sense.
Okay.
How long is nurse practitioner school? Is it after?
It depends. So there's master's programs that are online, in person, doctoral programs, the same thing. And I did mine through University of Washington, and ours was about 3 years.
So that's after undergrad? Right?
After undergrad. There's also PhD nursing, but that's usually they're more so the research route. But there's that, and I'm not exactly sure.
So this is more the patient facing.
Correct.
And
yes.
then there's the research route. That's pretty cool. There's a lot of diversity in what you can do.
Exactly. And between a master's nurse practitioner and a doctoral prepared, as far as prescribing treatment, it's the same, but it's just that we're doctoral prepared, more research, evidence-based in our didactics, as well as clinical.
That's pretty cool. Does your undergrad have to be in nursing, or can it be anything?
No, so there's advanced tracks where you could be a non-nursing background, but it's a speed course. I don't know how many years, and then you go into the NP school.
So there are a lot of different options. That's pretty cool.
And then what differs me from a family practice physician is that they went to med school and residency and fellowship. But as far as, prescribing treatment, it's the same.
Oh, that's pretty good.
And it varies from state to state, to be honest. So in Washington State, they're very pro nurse practitioner autonomy.
It's pretty cool. What skills or qualities do you think are essential to succeed in this field?
Okay, so qualities to exceed or excel as a family nurse practitioner, I think really good bedside manner. And that's where having a registered nurse degree really helped me, because I had, about 5 years at the bedside with patients, and knowing, getting to their level and building that rapport and relationship. It's a journey in primary care. It's not like an urgent care or an emergency room where you treat them and send them back to the streets. It's really important you build that relationship and trust. And also being realistic with goal setting, treatment, and seeing the patient as a whole person. I want to treat them holistically and not just looking at their chronic disease, but their lifestyle, their eating habits, and how that their mental health and emotional well-being, and how that goes into play in treating their chronic disease or issues that they're here to talk to me with.
It's a very holistic approach.
Exactly.
You have to see everything from every angle possible.
Yes. Someone could come to you for, anxiety, but until you understand why they're anxious or other external factors contributing to that anxiety, you won't have a good understanding. And there's pieces that you can miss and not treat appropriately.
It's pretty cool.
And really, and not just thinking of, medicinal treatments, but for someone with mental illness, therapy, community resources. Do they have support groups to help them get through what they're going through, as an adjunct to medications if needed.
So it's health as a whole.
Exactly.
Compared to focusing on one specific body part.
The whole person.
What advice would you give to students wanting to become nurse practitioners?
What advice I would give? I think it's a great career. It's very rewarding. I feel like it gives me a lot of purpose, and I really enjoy building these relationships with patients and helping them get to the best optimal health they can, both physically, emotionally. And I am all about, practicing what you preach. I'm not going to say someone, to exercise 30 minutes 3 to 5 times a week if I don't feel it's essential to my health as well. It's a very rewarding profession, but it does take a lot of work and sometimes time outside of the work to completing chart notes on time and things like that. But I wouldn't trade it for the world.
It's beautiful. How do you maintain a work-life balance in such a demanding career?
That's a great question. I'm only 4 years in as a nurse practitioner, and it was really hard my first year. But when I was in school, I had a really great clinician mentor that she was a parent, and when she clocked out at 4, she had to leave to attend family or personal things, and she really taught me good tools to be able to separate work from personal life. Something I do is being realistic with the patient during their visit with me, so that I don't run behind. And it's respectful to the patient as well as the patients I see before and after. And also setting those boundaries with patients, with messages sent to me, I make sure it's not urgent, and we have so much of 48 hours business hours to respond. And also with emails, messages from my colleagues or patients, saying up front that these are my days off, and outside these hours I'm not gonna be. I won't be looking at my Outlook or my Teams messages because so that I can really be able to be 100% focused on. I have little kids, my family, and also for me, it's all about self-care. I tell patients they have to take care of themselves before they can take care of others. And definitely. I 100% believe that for myself, for me to provide compassionate, holistic care to my patients, I have to do the same thing to myself. Definitely. And so I exercise, I hang out with my family, my friends that bring me a lot of joy, and doing things that I enjoy doing outside of work.
It's a really good message. It's definitely important because I know it can get hard.
And there's also devices that we have. So we now have like a AI scriber that does it. So it's really cut down on my chart note work time outside from work, which has been very beneficial. And also taking vacation.
Definitely,
you know,
that's also very important.
And so I'm a true believer of self-care and work and life balance. And I like, as of right now, it's very there's all these research and stories about provider burnout, but I think setting those boundaries from day one with our patients, with our
If you guys need a family medicine provider,
has
Dr.
been very
Shantal at
beneficial.
Snoqualmie Valley Health
Boundaries are very
Northbend
important.
Clinic is accepting new
Exactly,
patients.
totally.
Thank you so much, Dr. Shantal, for your time. Until next time, bye, Future Horizons.
Bye.
Bye.